So, as I say, here we are for the East of England launch of the Mentally Healthier Councils Network. We launched the national network a little under a year ago, and we've been having these regional events, and I think we're on 6 or 7 now, having traveled around the country virtually, meeting colleagues in local government, and it's been brilliant. We've had some excellent conversations and shared some really useful information and insights. Which is what the network is all about, really. It's about sharing best practice in local government to improve mental health wherever you are. So, as I say, Centre for Mental Health, which hosts the Mentally Healthier Councils Network, is the UK's leading mental health research charity, been going for over 30 years, supporting mental health equality through research, policy development, lobbying and campaigns. And we're commissioned by national bodies, including the NHS and OHID and others, and regional authorities like the West Midlands Combined Authority. The report that we did with them last year, their mental health strategy, is pictured there as an example of our work at a regional level, but also to local authorities and others to evaluate research and co-produce different approaches to mental health work in local, regional and national spheres. As all of you, I'm sure, are more than familiar with, but I will just refresh it now. The protective factors around mental health, the things that support good mental health, are things like having enough money, being treated fairly, having a positive parenting experience and a positive experience of school, secure and decent housing, access to healthy natural environments, getting enough exercise, healthy food, abstinence from smoking and substances, and feeling connected and safe in your communities and having good relationships with other people. I won't read all the risk factors out, but they're the kind of opposite from the protective factors. And the reason why I'm sharing this now is because most of them aren't really much to do with traditional healthcare providers. They're more in the area of local government and our other partners in our communities. So often when we talk about health in this country, we quite often get immediately into the NHS and waiting times and ambulance queues and all that stuff. As important as it is, actually the things that build really good mental health are also the things in our communities that local government and its partners and residents have more control over and influence over. So knowing that, at Centre for Mental Health, we have for a long time done our best to support and work with local government to try to make the best of the opportunities that local government has to support local people's mental health. And councils directly have loads of levers and influences around mental health, including formal public health responsibility, which returned to them after 2013 reforms. And that includes, trying to prevent mental illness, to improve well-being, directly to commission and provide substance use treatment, prevention and treatment services, health visiting, sexual health services. And obviously local government's also part of integrated care systems. They host the Health and Wellbeing Board and Health Watch. They're obviously responsible for social care and safeguarding of both children and vulnerable adults. They're the licensing authority for alcohol and gambling. They're the planning authority with influence over housing, transport and green spaces. Quite often they're the biggest social landlord in an area. They provide and are custodians of parks, community centres, libraries, advice, and other things that affect people's mental health. And often they're one of the biggest employers and economic actors in an area, as well as having a role in education. That little picture is done by my daughter, who's in the middle of her GCSEs. So let's hope she's done as well in her maths this morning as she did with a little diagram there. So because of those close connections between local government and mental health, that's why Centre for Mental Health started the Local Government Mental Health Challenge over a decade ago. And in that time, we managed to recruit over 100 councillor champions to champion mental health in their areas. And we did that really successfully, even though we only had a couple of years of funding, and then we did it just because we thought it was important. And then We've also produced mentally healthier councils manifestos for the last 2 years, and we'll do something similar every year for the time being. And as I say, we also have provided direct services to, I need to update this slide because we've now done 7 Greater Manchester councils. We work with Thrive London in London and their councillor champion network. And we consistently lobby for councils nationally when we get the opportunity. And we got some money from the Health Foundation, for which we're very grateful, to kind of have a relaunch of the Local Government Mental Health Challenge, which we've rebranded as the Mentally Healthier Councils Network, which is now open to officers of all kinds within local government, as well as elected members. And we've already got to about 300 sign-ups for that, of well over 100 councils across the country. So really good representation, and we're really eager to grow that further. So as I say, funded by the Health Foundation, free to join, open to all elected councillors and council officers. We want to recruit hundreds more, and the idea is that we share information, best practice and networking opportunities. We have a monthly e-news bulletin that Bethan, my colleague, puts together, and it's got a really, really good open rate and a read rate, showing that people actually value that. And as I say, we're in the midst of holding our 9 regional events, getting to the end of that now. The best ones today, obviously, the East of England. And we're looking at producing a report of something like 100 mentally healthier council policies, showing best practice across the country in local government. So if you have a policy you're proud of, it doesn't have to be directly to do with mental health. It could be something that just influences mental health. So we're hearing from colleagues to do with green space, but it could be housing or poverty reduction or child development. We'd love to hear from you so we can feature it in that document. And we're looking at creating an accreditation scheme to become accredited as a mentally healthier council. We're working on the metrics for that. And we're talking to OHID about aligning that with the Prevention Concordat that you may have heard of. And in July, we're going to have a national kind of 1 year on event that will probably be a hybrid event in London, but you can join virtually as well. More details to follow. So please do promote the network at any events or meetings that you may be at with colleagues. I'm sure my colleagues will post these links in the chat. So do share them with colleagues. It only takes like a minute to sign up. And do let us know of any relevant local government mental health news or policies, and we can put it in our e-newsletter, and that will go to over 300 colleagues across the country. And as I say, we can provide many, hopefully useful services to councils. So do get in touch if any of that sounds useful as well. So having promised to get you out on time, I should stop talking as quickly as possible to give other people the opportunity. And our first speaker this afternoon is Elizabeth Bailey, who is a public health manager in Luton. Very grateful to Elizabeth for joining us, even though she's got a bit of back pain. So
I have.
Sorry to hear that, Elizabeth.
It's all right. I'm going to soldier on. But
good for you. We really appreciate you doing that. If you are in pain or discomfort, just let us know. No problem, and we'll move on to the next one.
Okie doke.
I know
Let's start sharing the
Yes,
screen.
please.
Right. Now you need to tell me that I've got the right screen. You seeing that?
Not yet. Took me a couple of goes as well. You'd have thought we'd mastered it by now, but
well, it worked before, didn't we?
It did. Don't worry. Take your time.
Sure, I haven't got that much time.
No, but you should have the share screen option down.
Yeah, I'm going through the options. It's just not showing it to you.
Something's coming.
We've
got your screen, which is there we go. There we are. We've got your slides.
So I just need slideshow.
Yeah.
Which I can't see now because of the
top left-hand corner.
Yeah, I know where it is, but it's just
left a bit. Left a bit. Yes. Yeah, there we go. Well
Joy, done. We're working, right. Okay, bear with me just a second. Okay, so I've gone down a slide here, didn't mean to. Page up. So I'm here, I gather, in fact, I've been looking at who's coming in and out of the door, and I think Emma Bates from Milton Keynes my colleague from Milton Keynes has joined us, so she can chip in if she wants. But I'm presenting today. She was happy for me to present. would like to acknowledge her leadership on all of this work and the fact that I've nicked a lot of her slides this morning. But it's a great example of partnership working, and we're very, very grateful for Emma's work and the work across the boroughs. So let's try and be as brisk as I can. Obviously, we're all mental health related professionals, so we know that suicide is a major public health problem, with thousands of probably preventable deaths per year, and somebody losing their life every 90 minutes, according to the ONS and Samaritan statistics. We believe they're avoidable deaths, and they cause a vast amount of distress, economic loss, personal pain, and so on. Nationwide, it's a governmental priority, as you'll also know, and there is a 5-year cross-sector strategy to address this. Funding-wise, there's a considerable amount of money pumped into voluntary and social enterprise sector, but there aren't any specific funds for local authorities as things stand. There are also, despite the creation of the new strategy, there aren't specific fully worked through roles for all for authorities at this point. But we are working through our own community of practice in the east of England. We are working through that kind of thing at the moment. But the general thrust of the National Suicide Strategy and our local work is that everybody has a role to play. It's not just public health, it's not just health professionals. So to sort of whip through the key points in the suicide prevention strategy, it's about improving our data collection and evidence. Some of that's improved a lot over recent years, but there's areas where we're weaker, for example, collecting data around attempts and so on. Developing targeted support for priority groups. Common risk factors, which we'll go into a little bit further. Obviously, a big concern in the last couple of decades, online safety. The improvement of crisis support, mitigating and reducing access to means and methods, considerable improvement to bereavement support, and generally reducing stigma, reducing taboo, and making this everybody's business. So as we'll go on to say, we have local audits of deaths through suicide in the past few years, but obviously as the numbers are small, we don't always see the patterns that are seen nationally. But overall, we know that there are certain risk factors, physical illness, especially things like terminal diagnoses, financial and economic hardship, things like gambling, addiction and substance abuse, alcohol, especially very high risk, domestic abuse, and loneliness. We understand certain groups of people are high at risk, certain young people, middle-aged men, especially those who have been through relationship breakdown, history of self-harm, people who have already engaged with mental health services, definitely links with the criminal justice system. Something we've understood a lot more recently, and there's been a lot of very high quality epidemiology and research into this. It's the risks that come with being autistic, especially what used to be called in old money high functioning autism, so autism without intellectual disability. And perinatal mental ill health is also a risk. So we're 4 councils. We're Bedford Borough, Central Bedfordshire, Milton Keynes and Luton. And we're all in the historic county of Bedfordshire. Well, we're not, Milton Keynes isn't. We're in the historic county of Bedfordshire, and Milton Keynes is in Buckinghamshire, but we work together as a health network, and we've been working together on suicide prevention for some time. So it's a good example of councils working together on a specific topic where there are cross-cutting links, things like police and health services, and specific local concerns, and trying to work in synergy for everybody's benefit. And what we draw on for our evidence base are the national local strategies, the audit findings of all the local councils, Obviously, aspirations in the NHS long-term plan. Third sector intelligence, for example, the Samaritans, and generally the national evidence base for this area of work. So we've previously had a plan running up to this year, which was funded, and we've done it. I'll be able to talk you through a little bit of the work we have done. And so the point of what we're working on now is an update of the previous plan, and a lot of the risk factors and areas of vulnerability and action plans will be the same, but there are new things we've learned which we'll be building into the new action plan. I give, for example, risks associated with autism. So we work together on this, and we have a number of, we have forums where we regularly meet. So we have a steering group. We have a suicide prevention partnership. So we're sharing knowledge and best practice and planning around that. And we also have targeted groups, like we have a communications planning group. And we're involved in East of England and OHID structures as well. For example, we're involved in the community of practice in the East of England. So tell me if I'm doing okay for time. Okay. So, as I say, it's evidence-based. We look around, take a life course approach. We're very, very much focused on partnership, working with key agencies like the Samaritans, Mind, people with lived experience, family experience. Prevention and early intervention is key, and we are using as much real-time data as we have and looking to improve that. The general focus is, our general belief is that this is a preventable problem. So I won't read through all the details on this chart because I want to get through to some of the things we've done. We have our audits, our most recent audits. So all of the authorities have completed an audit recently. They're varying, but covering the last 2, 3, 4 years, depending on what people did during the pandemic. They're a little less, we had a little less evidence we have done in the past. And this time we were using the top line coroner's inquest reports mostly for evidence. So these are the finalised coroner's reports, and they will have all the official information and the coroner's judgment about the cause of death. Unlike, and it will be one of the things. One of the things you might have come across in ONS data is sometimes you'll see blips in local stats that aren't reflected in the overall audit stats because they're done to a different time scale. And obviously with coroner's full reports, there's a bit of time lag. So it's best to look at this evidence over time because sometimes you can see slightly distorted patterns. We work closely with the police. We get, and the coroner's office, to get real life notifications of suicides or suspected suicides. And we also collect a certain level of attempts data. That's our local system, and we work closely together to share information. We're also part of the new near to real-time national suicide trial, which is building a national system for real-time suicide data.
Just to let you know, you're at 9 minutes, Elizabeth.
Right. Oh, gosh. Okay. I'm going to run out of time quite quickly. So I can send all this information around to people with Emma's agreement. So we have a number of recommendations from our audit around reducing stigma, provision of training for professionals, media messaging, multi-agency real-time surveillance, support through after bereavement, reducing access, and appropriate management for mental health, and also improving data. So I think I'm going to run out of time, and I apologise for that. But we are going through an action plan refresh, which is currently being worked through. We hope to resolve it over the summer to everyone's satisfaction. I could, what I don't have time to do now, we're on 9 minutes, is to talk through what we've done in the past, but that we have been over the last, the previous iteration of the strategy, had a number of schemes going, including through the community grant scheme in Bedford, Luton and Milton Keynes, the suicide prevention pathway scheme with Mind BLMK, primary care training and Zero Suicide Alliance training recommended for professionals throughout the boroughs. So there's Zero Suicide Alliance. We've got the new fantastic BLMK Suicide Prevention Hub, which I can send you details about, which is a resource hub for local professionals, which builds on all our existing work, and it will be taking us through into the new action plan. And there's Better Days Work for Children and Young People. I can send you these slides. Stay Alive app's another piece of work we did. And there's a bit more on our communications. What I'm going to do is stop now because I've run out of time, but I'm here and Emma Bates to see if we can answer more questions and talk about suicide in our particular boroughs, with apologies for running over, but I've had a bit of a bad morning. Is that okay?
Yeah, that's brilliant, Elizabeth. You know,
Mm.
you've given us a really good flavour of that. And perhaps if you don't mind, you could put your email in the chat and people
I
could
will, yes. So I'm happy
directly
to
ask you
answer questions. And
Um,
I'm sure Emma will be if she pops up.
great. But if you do have questions,
Mm.
put them in the chat, everybody. Hopefully we'll have
Mm.
time to come
Mm.
to some at the very end, but we'll just get
Mm.
to our speakers
I can't, so
first.
does somebody have to share to get rid of mine? Oh, no.
I think if you go to the bottom, you can do stop share. The bottom bar should appear when
I'm having a lot of fun today with this and I can't find it. Can the other person just replace me?
Yeah. Oh, there we go. We got rid of it. Marvelous. Thanks.
Sorry, but I'm not, it's
No,
not
that's
not
really.
been my best start to the week.
Yeah, it's fine. Elizabeth, you were brilliant. Don't worry. It's all good. Okay, so we've heard from a public health officer, and obviously local government really is a partnership between professional officers, elected members, and also residents and other partners in the community. So next we're going to hear from someone who was an elected member until very, very recently. I was an elected member once as well, but a lot of further time away than Simon Feldman, who up until May the 4th of this year, I think I'm right in saying, was a councillor in Watford and in fact chair of the council. So it'd be great to hear from Simon now, from his experience as an elected member, having heard from a public mental health officer as well. Simon, over to you.
Thank you very much, Ed. A little introduction. In Watford, we have an elected mayor, then we have the chairman, which is a civic role. So I was lucky enough to do that for my final year in office. My theme for the town for the year was around mental health, being hospitalised due to major depression disorder about 1.5 years ago while I was still in office. So when I came back and recovered, it really gave me the power to sort of drive and put this to the forefront to our town. So the first thing I want to look at is strategies, looking outwards for residents, and it's something Ed covered earlier. And it's about councils knowing what you do well and knowing how that can play into the mental health of your residents in your area. As we all know, councils are under a massive financial burden at the moment. And a lot of time when we talk generically about mental health, we think it's associated with the NHS. But what we do have to play in is all the other services we provide, whether that's parks and open spaces, supporting community groups, helping organise our communities, and even just simple things like having IT and infrastructure support community groups to work together. So one of the key strategies is always seeing how we can keep those things and justify putting the money into those things so we can keep our communities a nice and lovely place to live. Another thing councils have a role in, something which we really don't touch on enough, is we do come into contact with the people when they're at points in crisis in their life, whether that's housing or financial crisis, and we're seeing that quite a lot at this moment. So a key role to play in is when we have those contacts, ensuring we're supporting those people to signpost them in the right direction, but making sure they get to that help, and how we're in a town we find out what help is available. So I'm going to come onto that a little bit later. And another thing councils have a responsibility for is our contractors, because more and more we're contracting out to third-party private companies, And so just because they're not under our roof, we have a responsibility to ensure these contracts ensuring the mental health and well-being of their staff. And that plays into roles like how much they're paying their staff, which comes into your well-being, holiday, and how much they're investing in their staff to improve their staff's knowledge and career experience and job security. So what did we do in Watford? So I sort of got thrown into this role and just sort of jumped at it. So the first thing we wanted to do was build on all the amazing community groups we have in Watford and how we could work together to improve the area. So we've got a range of organisations going from Hertfordshire Mind, Ollie Foundation, the local food banks and Watford Three Rivers Trust. And so what we set up was we set a monthly meeting to try and build awareness of all these organisations that are working on mental health in the community. So we meet once a month and we understand what the current challenges are, what the current funding situations are, and what the current campaigns are. And our ongoing workflows, which we have building from that, and the issues we've identified is data. It's really good to hear how Luton and those 4 councils are collecting the data. So what we're trying to do now is set up a database to find out all the services that are available in the area, the current waiting lists and the gaps in those services, because that's really important unless we don't know where to put our resources and where to put our efforts. And part of that database is working on a new signposting system just for Watford, where we take the live information of every service that is available for people, whether it's mental health or well-being. And we have this so a user can go on there, input the data of what they're looking for and find out the groups. This has come from a lot of feedback from people. When you come to signposting, what you get given is here's 5 charities, do the door knocking, find out what's going on. And the problem is when someone's in a mental health crisis or very unwell, they're not well enough to do that. So we need to bridge that gap and get them from A to B as quickly as possible, whether that's a men's talking group or a crisis support group. And we need to tell them exactly what that looks like, not just here's a support line. We say, okay, they meet at this time in this place, and this is what you click to join up and be a part of that. Because at the moment, signposting, a lot of people see it as giving someone a leaflet. And for me, being through mental health issues, that's just not good enough. And we need to up our game. If we're going to signpost, and especially if we're in a body of responsibility like a council, we need to ensure that person gets the support and gets through there and just go, here's a leaflet and walk out the front door. So we're working on that and it's really, really great. So many organisations coming on board, but it's come with challenges itself. So we're trying to work through that. Obviously, we've got a database engineer who's helping us build this. The second thing we're trying to do from that is the campaigns. Once again, we've got loads of communities and organisations in Watford trying to introduce campaigns and support each other. But separately, we're a quieter voice. So together, we're going to start building our campaigns and have a yearly campaign plan. A way we've helped support that as a council, just a simple IT thing, a Teams channel. So we can now keep in contact constantly via Teams, share live documents and share updates. So that's one way councils can assist supporting communities in their area. So the second thing I jumped on board was that's looking at supporting residents, but every town and council has a number of businesses working in their area, and those people may not be residents in their area. But once again, we have that responsibility to support businesses to improve the well-being. So we ran 2 seminars in my year of office, working with Hearts Mind. So the first one was just getting all these businesses to come along, speak about how they want to improve well-being in the workplace and talk about well-being action plans and how they're going to implement them and give them that cooperative support to know they're not alone on this journey. Then the follow-up one, which was really, really good, a lot more intense, was getting everyone back and saying, how's it going? What challenges are you facing? And what can you do to improve them? Because what we found, a lot of businesses, they have well-being plans, but they don't really have the officers or the staff in place to support it. And sometimes the staff feel quite isolated doing it. So giving them support and this structure really, really helped. And once again, we supported that by following that up with a Teams channel where they're all in contact with each other, can update each other with their plans. And only one of a little bit really, because I've sort of covered up quite quickly what we've done and what we're trying to achieve. Is just for councillors and officers in the public sector. and looking after their own well-being and the importance of that. And something as councils that we spoke about at the Wellbeing Business Seminar is EAPs, employment assistance programs, and not putting all your eggs in one basket, because they're not the answer. They have to be part of a whole approach. So all about how you build a well-being workplace with the spaces for staff to have good breaks, the good facilities, but then also teaching people, and especially elected officials, about switching off, having those off times on their Microsoft Outlook, having those times on their 8x8 channel where it turns off, and taking time for themselves. That's really important. So that's quickly what I did in my year of office. Really glad that in Watford we're continuing that work sort of as my little side project now, supporting these organisations. And well done for everything everyone else is doing. Thank you, Ed.
Excellent, Simon. Thank you so much. I can tell you chaired the council because you timed that beautifully. So you were obviously a brilliant chairman.
Was it bang on 10?
Yeah, it was bang on, amazing. So, well, you know, you just demonstrated the value of our councillor mental health champion scheme, because what we often found was you'd get an individual like yourself that might have lived experience or had cared for someone with a mental health issue, and then brought that to your role in your political role, and use that to take forward and push for policies and support that then bring that issue to the fore, and use the influence and the powers of local government to really do some good. And clearly you really did that in your brief but powerful time as an elected member. So I think that demonstrates brilliantly the importance of elected members. And I know sometimes officers can get a bit like frustrated with elected members, because you know, elected members are not experts in the professional field, but they can bring that passion and that insight from their own experience and that of their residents that they represent. And I think Simon demonstrated that brilliantly. So I really appreciate that, Simon. Some great insights there. So our last pair of speakers are both from a voluntary and community sector organisation called Trustlinks, I believe, which does kind of environmental work, but we're about to hear more about that. We've got Elias and Matt with us. And as I say, you know, local government is a partnership between elected members, professional officers, and the communities they represent, including their residents, but also voluntary and community sector business and everyone else who's providing or services. So great to hear from one of those kinds of groups as well. So over to you, Luton and Elias.
Thanks, Ed. So yeah, I'm Elias Watson. I manage the Growing Together project at Trustlinks. So Trustlinks is actually the largest sort of independent mental health charity within Mid and South Essex. We're made up of three sort of core arms, I like to think of it. So we've got Growing Together, which is our flagship project, and we've got 7 gardens that we manage as community therapeutic gardens, essentially. We've got our Reach Wellbeing Hub and Recovery College, which is psychoeducational courses and social groups. And then we've got our Children, Youth and Family Service, which caters from anywhere between 0 to 18, supporting mental health for youth groups, parents and toddler groups, and that kind of thing. On to the next slide, please, Matt. Thanks. So just to take a deep dive into Growing Together. So Growing Together is a therapeutic gardening project. We started in Southend around the millennium year. So we've been going over 20 years now. And it started just with an abandoned allotment site. And a small group of local volunteers decided to make use of the site, and ultimately ended up realizing that they're sort of supporting people with their various needs, vulnerable people coming along, people who needed socialization, support with their mental health. So over the years, we've sort of developed into this charity that puts sort of mental health at our core. Although we're all about gardening and the environment and bettering our local environment, it's about improving people's mental health. So it's a really simple referral process. We have an online web form, and people come in, they do a taster session, have a little tour of the garden, meet some of the staff and the members. It's a nice, easygoing process. They have a taste today, and then we have structured activities through the week. So someone will come in and they will help out with the garden and really take ownership of it as well. So rather than have people as patients or service users, we call them members because they're kind of members of our community. And what I really like is we kind of break away from a clinical relationship. So a lot of people have experiences in sort of institutions or school, or they've been in care. If they've got long enduring mental health, they've got these kind of traumas from their life, and actually sort of clinical settings can be quite off-putting. So when we have people come to us and they're in the garden, but they're also invited to sort of talk to professionals about their mental health, and they really open up and build a really strong rapport. The great thing about growing together is we've got these sort of positive activities. So naturally, gardening is like a physical activity. You're getting fresh air, you're getting some sunshine, and we also have sort of art, music, creative writing, yoga, lots of different sort of supplementary activities. We find it's really good conduit to socialization as well. So lots of the people who come to us are extremely socially isolated. It's one of the big things that's causing sort of issues with people's mental health, and they go from not having any community connections to coming to growing together and doing a day or two a week and having about 20 to 30 friends who they suddenly are working towards a common goal with, looking after the garden, meeting people. And so it's a really good conduit to sort of bring people out of their shell. Do you want to go on to the next slide there, Matt? Yeah, so there are different sites. We've got quite a big spread. So we started in Southend, and we've got Rochford, Shoebury-Ness. We're coming to Canvey Island as well. Last year we opened one in Basel, and it's got a real good spread through South Essex. And then we do a little bit of work out towards Witham and Braintree as well at Cressing Temple. So yeah, here's some of our outcomes. We sort of demonstrate that time and time again. Being outdoors, being gardening in a community improves your mental health and well-being. You've got that sort of nice exercise, gentle exercise. Yeah, really good conduit socialization. It's a great way to meet friends. And then what I was going to say as well is just thinking about Simon's point of people who kind of go to the council or go to their GP for more support. They get referred and they might get bounced around, and there's not that hand holding. Because we're a really strong community hub and we build that really good rapport with our members, we can offer that sort of really sort of supported hand holding for people to access other services. So someone might come to us and might be referred to us to do a bit of gardening, but actually they end up, as they build that that trust with us, they end up disclosing maybe issues with housing or sort of the drug and alcohol abuse issues, and then we can actually support them to access services as well. Yeah, so we did a really good evaluation in 2022, and we did a short work Edinburgh wellbeing score test, and you've got this big leap from when people are sort of coming in with below average wellbeing scores, and then they have this leap to well above the average. And the big thing that's reported from that, when we sort of dug a bit deeper into that and asked people what helped, was that sense of community, that sense of socializing, working towards a common goal, and that ownership of the space.
So thank you, Elias. I'm Matt. I'm the Chief Executive of Trustlinks. Just to introduce you to Luke. Luke's one of our, he was a long-standing member. He was referred with autism, Asperger's, was very isolated. He'd been barely left his house for a couple of years, very anxious, got referred in through his occupational therapist, got a real fascination for and passion for gardening and horticulture. So as Elias says, he did a qualification in horticulture, did training with us, then went to RHS Hyde Hall, did some training with them and became an apprentice with them, came back to us as a horticulture teacher, and now works part-time for us. And the journey that he's been on, the confidence that he's developed, the relationships that he's built, it's just transformed his life. And somebody that wasn't interested in gardening, didn't have any knowledge around it before, but just got involved with it, got a passion for it, got his energy around it, and transformed his life. And we've got numerous stories of people that have benefited from the Growing Together project like that. Just in terms of local authority partnerships, so we work with different local authorities at different levels, commissioning grants, strategic partnerships. We're part of the Health and Wellbeing Board. I chair the mental health subgroup in Castle Point and Rochford area. We kind of work at a very operational level as well as at a strategic level in terms of mental health strategy and mental health development. Obviously, local authorities have parcels of land. All of our sites are either on redundant allotments or places that weren't used. So we've kind of entered into these lease agreements with them for like peppercorn rent, to have the land for sort of 25 years, that sort of thing. Obviously, local authorities have grant commissioning opportunities, so we tend to apply for most of those where possible, and trying to just engage with different local authorities depending on what their needs, what their interests, what their aspirations are, and just looking at all those outcomes. The Growing Together project can kind of work to achieve so many outcomes, both mental health, physical health. So we work with a range of partners, and then that kind of feeds into our funding model, which is basically to have quite a diverse range of funding sources. So we have personal budget, self-directed support for social care, for individuals that come with high needs, but then there are individuals that come that aren't eligible for personal budget. So then they come through other funding routes like grant funding, commissioning opportunities. We work really closely with the DWP, so they give us sort of block funding for employability programs. Work with Sport England, Active Essex, and other partners around getting people more active. Through the Police and Fire Crime Commissioner, we've had funding to help build community safety, build resilience. And then we also do a lot of community fundraising, work with local corporates, donors, in-kind sponsors, those sorts of things. So the more obviously diverse income sources, the less reliant we are on one where that dries up. We can then access funding from other sources. Got a 2-minute video. Have I got 2 minutes, Ed? Let's see if it works.
Yeah, go for it. Yeah.
Oh, I'm not sure we're getting the sound.
Always the sound. That's the trouble.
There is a complicated thing about getting sound on Zoom, isn't there? But I don't think I know how to do that.
Well, if we can't do it, we'll make sure we share the link to the video. Give it another try. Otherwise, we'll share the link to the video.
Not working.
And here's something, but it's very quiet. Yeah, I don't think it's working, unfortunately.
Okay, not to worry.
But we will share the link around.
Okay. I did have one more slide. There we are. I was just going to mention our program called Let's Grow Together. So what we do is we have a program where we support other people to learn from what we do. We don't want to become like a big regional or national charity. I don't want to drive to lots of places the other end of the country. However, we do have a program where we support others to learn from what we do in the 25 years that we've been developing Growing Together. So our Let's Grow Together program, we've developed a manual which outlines all of our systems, all of our processes, our approach that we take to the Growing Together project. We then do 6 online sessions for people, and then they can come and do work experience and also get consultation and engagement with us around their what they need specifically. So this is for other community groups, organisations, housing associations, local authorities could go on it. So others that are interested in kind of learning from what we do, replicating it, but doing it in their own way, in their own local context. So the links there, we'll put that in the chat as well. You've got mine and Elias's email addresses there too. But yeah, thank you for listening, and we'll circulate this round.
That's brilliant. I love that. I just think, like you've set out, knowing the evidence that exercise is good for people, social contact is good for people, spending time in green space is good for people. So you're ticking so many boxes through that particular activity. you know, it's just a great way in, isn't it? And like often it's just finding an angle that allows people to engage. Like I know a guy who runs a football charity around the corner from us, and the football's the hook for the young people, but it's about so much more the mentoring and the peer support, and then they open up about other issues, and they get fed in the holidays and all this stuff. So the actual activity isn't the most important thing. It's the reason to bring people together and then work with them in a brilliant way, and that's what you've done. And the other thing, there's a thing where I live called the Lambeth Food Growing Cooperative, Lambeth GP's Food Growing Cooperative, and they put planting beds around GP surgeries, and then they kind of socially prescribe the food growing activity to patients who might have come in with depression or diabetes, and again they then get the social contact, the physical activity, the being in green space and everything, and it's been really, really successful. So I think that's a great model, and it shows the importance of statutory authorities. Sometimes are so big, we need to work with smaller organizations that have a kind of specialism like yourselves to get that sort of connection with communities and that expertise, and that's what on a good day councils are able to do. I also salute your diversifying your funding streams, because like we all know what happens to charities when they are too reliant on one contract or whatever. We used to be the Sainsbury's Centre for Mental Health. We used to be one donor, and we did survive the end of that, but you have to be very careful. So you're obviously doing the right things here. Great stuff. So if anybody has any questions for us at Centre for Mental Health or any of our brilliant speakers this afternoon, do put your hand up like in the usual way, or post something in the chat. It would be good to hear from some other people if you've got similar or something from elsewhere in the region you would like others to hear from. But I mean, all 4 speakers have been great, and as I say, they show that diversity, that the importance of having professional officers who, like Elizabeth said, bring together the evidence and come up with good strategies and implement them. Elected members like Simon was, and myself, who champion the issue and use our lived experience and our experience of what our residents tell us, and then VCS, but other organisations like Elias and Matt's, who get commissions hopefully from councils or get to use their land, and have that kind of therapeutic alliance between everybody. And that's what councils are all about for me, is bringing those different bits together. That was me waffling, buying you time to ask really amazing questions, but you're probably still eating your sandwiches or something. So unless I see a hand, then I might give you a bit of your time back. All 8 minutes of it, aren't I kind? So do something for your well-being. If you're not going to ask a question, then I insist you go out into your garden if you're lucky enough to have one, or at least make yourself. Oh, here we go.
Last thing I'm doing is gardening with my back.
Oh, sorry, Elizabeth, not for you. You can look at a pot plant.
Oh.
Oh. Emma's asked me, is there a timeline for the prevention concordant work with OHID? Very good question, Emma. So as you may or may not be aware, so OHID is the Office for Health Improvement and Disparities, which was when, and I still can't believe this, when the government in its wisdom got rid of Public Health England in the middle of a global pandemic. Part of the replacement organisations, one was called the Office of Health Improvement and Disparities, OHID, and it's responsible for kind of public mental health stuff. And they have a thing called the Prevention Concordat, which is a set of sort of asks or commitments that local authorities and others can sign up to say they're going to do this and that to prevent mental ill health and improve well-being. OHID has been quite significantly cut back in its resources, and so they're just looking at how they can run things like the Prevention Concordat with less resource, let's be blunt. And so we're in talks with them about cooperating with them to see how we can help. And as I say, in any case, we were going to do this kind of accreditation scheme for local councils to kind of become accredited as a mentally healthier council in some way. So given they're quite similar ideas, we thought maybe it's a good idea to work together so that we can share our resources and make the best of that opportunity. We want to do that in the next year, is the long way of answering the question, Emma. It was always part of our year 2 plan for the Mentally Healthier Councils Network. So we will continue having those talks with OHID, but I suspect within the next 3 to 6 months, we will have some news about how we're going to take that forward. So hopefully that kind of answers the question, but I don't really know, to be honest. So it's all a bit up in the air, but we'll definitely be doing something, if that helps. So anyone else got a last question or comment? So really appreciate all of our speakers who are all brilliant from their different bits of the world and the system and experience. Really appreciate my colleagues as well for organising. Beth and Hannah, thank you so much, and Callum for all helping out behind the scenes. I found it a really fascinating, great session. Please, all of you go away and share the link to sign up to the Mentally Healthier Council Network and get your colleagues to do so. It's open to everyone with a .gov.uk ending email address. We'd love as many elected members and council officers as possible to join up. It's free, only takes a few minutes, no obligation, just to get great information. And yes, we'll send you more details if you're signed up to it for our national event, which will be at the second half of July, where you should hear more of our plans for year 2. But we really appreciate everyone's giving up their lunchtime or some of their lunchtime, sharing their experiences and expertise. And we look forward to working with you in the future. So take your 5 minutes and do something good for your well-being, even if it's just making a cup